So anything that is a change from their normal behavior. Of course, every parent's nightmare is a brain tumor. Some of the classic signs in pediatrics is early morning headaches, waking up with a headache, vomiting, changes in gait, changes in the way that the child walks, sometimes also changes in the ways that the eyes move. So anything concerning like that would prompt a call to the pediatrician or urgent visit to the pediatrician and then referral to a neurosurgeon. So pediatric neurosurgery is also taking care of problems that affect the brain and the spine, as well, sometimes also skulls. With pediatric neurosurgery, we see a lot of problems with the shapes of the skull. We also see a lot of congenital problems. The babies are born with something that affects their spinal cord or their brain. In terms of the difference, we tend to follow the pediatric patients sometimes from the time that they're born until they graduate from high school. So there's also that primary care aspect of care that we really get to know them very well. We get to know the families, which is part of the reason why I wanted to become a pediatric neurosurgeon. So there's really two aspects in that spectrum. In one hand, pediatric brain is very delicate and also a lot more vulnerable to an injury. What we see in babies who fall or God forbid, are shaken. But we also see the other end, which is they recover faster. The brains have more plasticity. So they can actually recover some of the functions that are affected by an injury or a disease much better than an adult can. Also, with some of the spinal injuries, the recovery times and the extent of the recovery are better. So we see problems with brain fluid circulation, something called hydrocephalus. Sometimes that can be a congenital. Oftentimes premature babies can have bleeds into the fluid spaces that clog off the normal circulation and they develop hydrocephalus. We see brain tumors and unfortunately we see trauma, we see accidents, pretty much the whole realm of things that you would see in adult neurosurgery plus then some. Maybe spinal disorders a little bit less than in adults. Certainly in degenerative spinal disorders, we see very little because tissues and discs are still nice and young and plump. So mainly spinal injuries when we talk about spine. Probably most of the time we do not operate. So there's many conditions that we get consulted on in the hospital settings. Traumatic injuries, we watch them, we medically manage them. In the office, we see a lot of patients that come in, and if we can treat conditions symptomatically, we will. If the patient needs an operation, it's always a big deal. We always take into consideration alternatives and really counsel the families. We a lot of the times we do not operate, but when we do, we'll take great cautions and make sure that we are very well prepared because again, pediatric patients are different from adults in the sense that the very small young patients, the blood volumes are much different. Their physiology and anatomy is different. So we'll have to adjust to based on the patient's age. So we see a lot of congenital conditions, patients that are sometimes born with a spinal cord outside the actual spinal column, something called myelomeningocele. We can see conditions that develop during the fetal development. Something didn't go quite right. A structure that was supposed to not be there or be different is now something that needs to be surgically repaired. Pediatric patients are different from adults in the sense that the very small young patients, the blood volumes are much different. Their physiology and anatomy is different. So we'll have to adjust to based on the patient's age. So anything that is a change from their normal behavior, of course, every parent's nightmare is a brain tumor. Some of the classic signs in pediatrics is early morning headaches, waking up with a headache, vomiting, changes in gait, changes in the way that the child walks, sometimes also changes in the ways that the eyes move. So anything concerning like that would prompt a call to the or urgent visit to the pediatrician and then referral to a neurosurgeon. Sometimes the changes can be very subtle and very gradual, but if there's a child that's toilet trained and all of a sudden starts having accidents, that's something that needs to be checked out. So, most of the time the urgent situations are any kind of rupture of a vascular lesion that would cause quick decline in neurological status, but those would be pretty obvious. But otherwise, some of the changes in the pediatric patient can be a lot more subtle. Pediatric skulls are made out of growth plates. So if the fluid circulation system starts getting clogged up or is not working properly, it can be subtle, and the change can be just a very fast growing head or a tense, bulging fontanelle. Versus if that same thing were to happen in an adult, they would get sick very quickly because they don't have growth plates anymore that allow the expansion of the skull. A lot of the prenatal care has changed the degree of certain things that we see in children that are born. So prenatal vitamins, folate in regular food, that was actually figured out that there was a connection between myelomeningocele and folate. That change has really minimized and decreased the amount of that type of congenital problem that we see. In terms of other types of neurosurgical problems, trauma is a big thing. So putting kids in bike helmets, seat belts, child car seats, educating parents about how delicate the infant brain is, not to shake a baby if they cry. Those sort of things can help prevent some of the injuries that we see. So at St. Christopher's, everybody is trained and geared towards taking care of children. So they understand the anatomy and the physiology of a child, neonates, toddlers, all age groups. And they also are very comfortable in taking care of the entire family. So it's a family thing when something happens to a child. So they have resources that make the stay at the hospital or the visit to the neurosurgeon as comfortable as possible. Because our goal is to try to get the child out of the hospital back to the playground as quickly as possible. GNI neurosurgery is unique in a sense that we have a whole team of neurosurgeons with different specialty trainings. So there is no condition that we can't take care of because we have a vascular neurosurgeon who will, together with the pediatric neurosurgeon, tackle some of these most complex cases. We have an epilepsy and a functional neurosurgeon. We've done very complex cases involving intractable seizures with surgical cure. So I think that's our strength, is that we are so multifaceted that we have everything, all the tools that we need to take care of these conditions.